The next part will be obstetrics. Now let's examine how the menstrual cycle occurs. Basically, there is a follicular or proliferative phase. The anterior pituitary releases FSH, follicular stimulating hormone, which causes the development of a primary ovarian follicle. The primary ovarian follicle secretes estrogen, which causes the lining of uterus to proliferative. At the mid-cycle, the 14 days, there is a LH spike in response to an estrogen surge. At this point, in response to LH surge, ovulation occurs. Now we have the luteal or glandular phase. The rupture of the follicle causes the release of the ovum and the corpus luteum. The corpus luteum secretes progesterone and estrogen. So there will be at this point two possibilities. The ova gets fertilized or the ovum doesn't get fertilized. In the first situation in which the ova get fertilized, then it develops into trophoblasts and secretes HCG. Now the corpus luteum secretes a progesterone and estrogen and makes the endometrium glandular to receive the fertilized ovum. Trophoblast secretes HCG until the placenta develops and maintains the corpus luteum. In the other situation, in which the ovum doesn't get fertilized, there will be no trophoblast, then there will be no HCG, then the corpus luteum involves, there will be no progesterone and estrogen, and then there will be the sloughing of the endometrium and the menstruation will occur. Let's examine the human chorionic gonadotropin HCG. Beta-HCG is the beta subunit of HCG in urine, which is the gold standard. Pregnancy test is the detection of beta subunit of HCG in urine or serum. Beta-HCG can be detected in urine 1 week after fertilization. For example, the pregnancy test can be positive the day of the missed period or even earlier. HCG initially produced by trophoblasts followed by placenta. The HCG level increases almost doubles every 48 hours. HCG is almost 100,000 units per ml by the 10th week. It then starts to decrease. It settles down to 20,000 to 30,000 units per ml in the third trimester. Such significant points to remember about HCG are: HCG is usually 1,500 to 2,000. It means that the gestational sac is at 5 weeks. If the HCG is between 5,000 and 6,000, then the gestational sac is about 6 weeks. It will be low in ectopic pregnancy, will be high in molar pregnancy.